Vascular access devices are the most commonly used medical device in healthcare today. Over 90% of patients will require some sort of vascular access to facilitate delivery of essential drugs and fluids, while 70% of all hospitalised patients will require a peripheral intravenous catheter.
Hello.
Vascular access devices have a tube-like structure whereby the internal volume and the vessel in which it sits must remain patent to the flow of blood and fluid in both directions.
That wasn't here a minute ago.
Regular flushing of the device with normal saline is a commonly employed strategy to prevent occlusion and infection.
Hello again.
But the impact flushing has on blood componentry and the vessel itself
Hello again.
is poorly understood.
Who put that there?
Here, due to the presence of the catheter, blood flow is slightly slower than normal. Over time, platelets will transform, during the process theorised in Virchow's triad. The components of this triad are stasis of blood flow, endothelial or vessel wall injury, and hypercoagulability. The very act of IV cannulation causes the vessel wall to be injured and interrupts blood flow due to the space it occupies,
Don't worry.
which causes the activation of platelets, ultimately contributing to thrombus formation. Regular flushing of the catheter is defined as the act of moving fluid out of a vascular access device and into the bloodstream to assess and maintain patency and prevent drug precipitation. But there's more to IV patency than rinsing the catheter. Let's have a closer look. A typical IV flush of 5 to 10 mL of normal saline is delivered over 3 to 5 seconds, or 2 to 2.5 mL per second, which, when compared to the normal rate of blood flow, is very fast. This quick and pulsatile flush may be effective at rinsing the internal surface of the catheter, but it isn't so kind to the vessel wall and blood components.
Watch it.
The shear force created by the flush causes turbulence and recirculation at the catheter tip that forces the platelets and blood cells to collide with each other, and in line with Newton's third law, every action has an equal and opposite reaction.
I do beg your pardon.
The resulting stress and inflammation caused to the endothelium and the presence of the catheter further encourages coagulation and thrombus formation, which increases the risk of IV failure. It could be that the quick flush, while good for rinsing the catheter,
I say.
may not be so good for the vein and blood flow, and may be a contributing factor to IV complications and failure.
Mind how you go.
With this knowledge of the potentially adverse physiological response to high-pressure flushing or infusion, we hypothesize that the optimal flushing or infusion should mimic the rate of blood flow similar to that of the patient. To minimize stasis and platelet activation, best IV maintenance practice may be a combination of slow, continuous infusion
Can't stop.
combined with regular intermittent flushing delivered with a gentle technique to minimize the inflammatory response. And this means a happy vein, a happy IV catheter, and a happy patient.